right, 5 minutes after 10 o'clock. It's a beautiful Friday morning, and Kelli Hart is in the studio, making it a little more beautiful.
Oh, thank you.
Good morning, Kelli. How you
Good
doing?
morning. Hi, how are you?
Pretty good. Where have you been? We missed you.
I know. Well, we had deadline. There was a deadline issue, and then we had storms, tropical storms.
How'd you fare? How did you do?
Fantastic.
Any trees in your neighborhood or anything?
In my neighborhood, yes,
Yeah.
but not specifically around my home or anything. There was like a few twigs
How
and
about
moss.
near the magazine, near where your offices are? There's a lot of trees there.
Yeah, and you would think because of how old they are and how big they are, but I didn't see anything
okay.
major. Just, a lot of moss everywhere.
Well, the city does a pretty good job of culling the branches that need to be culled.
They do, and because we're on Fort King, and because that's such a busy street, I think there's priority when things happen to get it cleaned up rather quickly.
I think so, yeah.
I think we're really good over there. So I am happy to be back. The new issue of Ocala magazine is out. It's fantastic. I don't know if you've seen it out there.
I did, yeah.
Oh yeah, it's in the lobby,
I looked at it yesterday.
So we had a really good time we called all the local high schools, public and private alike, and said, send us your star player who we need to be looking for this football season. And with the exception of one school who just had some timing conflicts and could not make it to the studio, every school is included in there. So we had a lot of happy families and a lot of happy schools. And I can tell you, the gentleman, I mean, he's a kid, but he's a gentleman.
Sure.
On our cover, his name is Robert Rivers, and he is a star player at Trinity Catholic High School. And his parents came in yesterday, so excited.
Because he's
excited.
Cover,
yeah,
right?
He's on the cover, and so
that is exciting.
Yeah, so
they put that in a frame, right?
Oh yeah, I think they want to make a poster. A lot of the kids, they were all, I will say this, the kids that came in were so well-mannered, yes ma'am, and even though it made me feel kind of old.
Oh, nice.
They were all so nice.
That made you feel old?
It did. It kind of made me feel old, but it was also nice to know that, they're student athletes and they're very nice and very well mannered.
Way? Tom Schmitz shared a video of this football team that came out and put a yellow rose at the foot of this cheerleader who had been undergoing cancer treatments.
Oh.
And so one at a time, they all were honoring her with the rose, and you could see it in her face, and you could feel it in yourself as you watched it.
Excellent.
I guess I'm just trying to say that the news sometimes portrays any group of people, you name them, but particularly young people as, having no ethics, but 99% of them do.
They do.
They do. So,
and
that's
athletes,
nice
I
to
think,
hear.
have an obligation to kind of step up and shine. So
Nice.
kudos to all these kids, and make sure you grab an issue. If you haven't gotten a hard copy, it's also on ocalamagazine.com. You can see it digitally. And this morning I want to introduce someone who, it was kind of serendipitous, I guess, because, what drives the magazine, of course, is advertisement. And we sometimes meet clients who we don't just have a business relationship with, but something that they're doing touches us personally. And one of our sales folks, Kyle, had come to me and said, listen, I met with this physician, and it's a really great opportunity for us to help get some information out and use him as a resource and build a working relationship. And when I found out what he does, which I'm going to talk to him about in a few seconds, it was interesting because he does workshops and speeches on symptoms and signs of strokes and heart attacks.
Oh, my goodness.
And it was in that same week that I had just found out that my grandmother had had a heart attack the previous week without knowing that she had had a heart attack.
Oh, my gosh.
And so, of course, our family was touched by that. We thought, how in the world can you have a heart attack without knowing? I always assumed that you would know. And so there are signs and symptoms. So I want to introduce Dr. Savino this morning. Good morning. Thank you for being here. And I'm going to let him talk a little bit to us and tell us some of the signs and symptoms of heart attacks. But I also want to give a phone number, which is 622-WOCA, in case anyone has any questions they'd like to call in and ask Dr. Savino in the way of strokes and heart attacks. So good morning. Thank you for being here.
It's my pleasure. I'm really excited to be able to get the word out to the public, because I really believe that an educated patient and who partakes in his care is a well patient, and that's my belief. So I do these community talks at least once a month at the Medical Health Center here in Ocala, and sometimes I go out to various places. And I do it on various topics, signs and symptoms of heart attack and stroke, sometimes about heart failure, arrhythmias, irregular rhythms. I call it "You've Got Rhythm." In other words, I try to have a heart-to-heart talk to people about their heart disease. And today, next Tuesday, 3 o'clock at Brookdale Paddock Hills, I'm giving a talk on signs and symptoms of heart attack and stroke, but also risk factors that lead up to that, because I think it's important that people know what the risk factors are and what risk factors they could change to help them improve their condition. And also on August 27th at the Medical Health Center, Super Urgent Care on Southwest 17th Street. I always say near the bowling alley because people know where that is. I'm giving a similar talk, or I might even change it around and give a talk about arrhythmias, because today the older population in particular tend to get arrhythmias, particularly atrial fibrillation, which can also be a leading cause for strokes. And so I think that may be another topic I might give. Recently, we gave a talk. It was very cute and very interesting. I think Dave Mornay, who was a paramedic, came in, and we actually had the dummies for these people to practice. It was cute watching these 80-year-olds try to do CPR, but it was important to get them understanding what to do if possible when somebody does have a heart attack. Basically, I think what's important is that you understand that signs and symptoms vary very much depending on what your underlying condition is and what your age is. Generally, as far as a heart attack goes, the traditional, elephant sitting on your chest with pressure radiating perhaps to your arms associated with shortness of breath, though probable in a majority of cases, is not always the way the presentation is, especially in the elderly population over the age of 70, and especially if you have diabetes, because diabetes affects the neuropathways, and to put it simply, it just affects your system. So you could just present with simply just fatigue, a little shortness of breath, sweating, maybe just even jaw pain, and even the digestion could be a presentation for a heart attack. So I think depending on your overall clinical status, and some of your risk factors, which I will go into, if you have symptoms that hit you suddenly like that and just make you just feel totally blah, you may be better off just going to the emergency room just to make sure. It's always better to be sure than sorry, because time is of the essence when you have a heart attack. If they're going to treat you, there's a few-hour window where they could do an intervention to actually prevent any more development of heart muscle death.
Is there anything you can do? So if I believe I'm having a heart attack, and I'm going to gather my things and get myself to the hospital or the emergency room, is there anything that I can also do that might help? Because I have heard things, maybe taking a baby aspirin or something.
Well, actually taking a whole aspirin.
Okay.
325 is the dose to take, or 4 baby aspirins.
Okay.
And you're advised to chew it, because when you chew it, it's absorbed quickly through the membranes in your mouth rather than wait for it to be absorbed, because the sooner you take an aspirin acts on the cells called the platelets, and what happens when you have a heart attack, the plaque usually bursts and the clot forms, and it's the clot that decreases the blood flow to the heart. So if you deactivate the platelets, you prevent the clot from forming, and you allow blood to go through. So that's basically all you could do.
Wow.
But I must advise, though, that if you have an allergy, that you should to aspirin, do not take the aspirin, because that could cause a more disastrous effect.
Okay. All right, we need to take a break. As soon as we'll come back, we'll talk about some more signs and symptoms so we can help educate people. Thank you.
The weather is brought to you by myfwc.com. Safe boating is no accident. Sunshine mixing with clouds on this Friday with a thunderstorm around during the afternoon and evening hours, the high 89 to 93. And partly cloudy overnight Friday night, low 72 to 76. For Saturday and Sunday, sunshine mixing with clouds, a thunderstorm around during the afternoon hours of each day, the high both days 88 to 92. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
There are only a few things in life that you can be certain will always be around: death, taxes, the pursuit of happiness, and computers. As they continue to advance at an epic pace, the one absolute certainty about them is that they'll break. It's not an if, it's a when. And when it happens, bring it to the only company in Ocala that's certified in Apple and Microsoft, Ocala Mac and PC Repair. They even offer on-site computer repair service, so they come to you. And if you do drop it off, you can check your repair status online. Ocala Mac and PC Repair is a family-owned and operated company that can do everything from mobile repair to wireless networks, fixing viruses, data recovery, even building and installing new systems. Visit online at ocalamacpc.com. In person, 1713 East Silver Spring Boulevard, or give them a call, 352-566-8324. That's 352-566-8324. Ocala Mac and PC Repair.
Hi, my name is Erica Olstein. I'm a doctor of acupuncture and oriental medicine. Do you have a gout-ridden toe or bowels that move too slow, creaky knees, or how about an asthmatic wheeze? Then acupuncture is sure to please. Come visit me, your primary care physician, Erica Olstein, at A Better You Healthcare. Call me at 352-615-5566. That's 352-615-5566.
Hey, this is Matt Wilkerson with Verizon. Do you have teenage drivers or elderly parents that drive? I have what you need. It's the new Hum device by Verizon. Plugs directly into your car and sends alerts to your cell phone on the location, speed, and driving habits. And you set boundary alerts. You can call and speak live with an ASC certified mechanic. And if you have an accident and can't respond, Hum will automatically send for help. All this and more for just $10 a month. And if you're in Marion County, I'll even deliver and set it up for free. Call me 352-528-0020.
WWWCA,
All right, it's 18 minutes after 10 o'clock, 81 degrees. Let's return to Kelli Hart, Ocala Magazine Radio, and Dr. Leonard Savino. Did I say it right?
Yes. Yes, you did. And I want to remind anyone, if you have any questions for the doctor, please give us a call at 622-WOCA. I also want to make sure everyone's dates are correct so they can save the date and come and see him speak for himself. That is September 27th at noon at MHC. Lunch will be provided, so it doesn't get any better than that. Likewise, on September 13th, 3 p.m. at Brookdale Paddock Hills. He'll also be speaking. So it's great information. I mean, I think sometimes a younger person like myself assumes that we're not really at risk yet. Mm-hmm. You have to be much older, but I don't believe that that's probably the case.
No, I think that there are so many conditions I can't get into now, but even young people, depending on your risk factors, which actually includes the major risk factors are diabetes, hypertension, cigarette smoking. Those are the three major factors. Obesity obviously is a factor. Being 20% overweight can lead to heart disease and heart attacks and strokes. So these are the things that you can do to help yourself. How could you help your cholesterol? I'm sorry. That's a major factor. If you look at the trend of death in heart disease over the past 30 years, has definitively gone down dramatically. But because of the increase in age of the population, heart disease still plays a major role. There are about, I think, 1.7 million to 2 million heart attacks a year in this country. And of those, about 200,000 to 300,000 die before they even get admitted to the hospitals. Wow. So it's important, and I think a lot of that is because of delay and ignorance of what's going on. The longer you delay, the greater the chance that something's going to happen to you. But even younger patients can develop heart attacks, and part of that depends on your genetics. If you have a father who had a heart attack in his 40s, or a mother who had a heart attack in the 50s, that could put you at greater risk of having a heart disease at a younger age. So these are the things that a doctor, when he approaches a patient, and that's what I believe in. I individualize my treatments of patients. Each patient is a special person, and you can't just generalize. So you take everything, you put it down, you figure it out. They even have calculators to help you out if you need it, and then decide how aggressive you're going to treat the patient. So even younger patients in their 40s, 50s, if they're hypertensive, diabetic, and they're smoking, may be at high risk of having a heart attack or a stroke. And talking about strokes, I guess I should lead into what the signs and symptoms of a stroke are. I think the easiest thing is to use the acronym called FAST. FAST relates to F, meaning your face. If you have some sort of droop or an unequal contour to your face, like your lip is drooping or something, that may be signs of a stroke. A stands for arms, and usually arms and legs. If you either one or both of your arms or legs are weak, suddenly weak or numb, that may be a sign of a stroke. S stands for speech. If you have garbled speech, slurred speech, or your speech makes no sense, that could be signs of stroke. And T is time. The sooner you get to the hospital for a stroke, the sooner they could initiate treatment, because there's about a 4-hour window before they could give you what's called a clot buster. It's called thrombolytic therapy, which can dissolve the stroke and spare the brain from further damage, because once the brain is damaged, there's no repair, and the stroke could be disastrous, not only one of the leading causes of death, but comorbidities such as paralysis, nursing home stay, and all that. So it's very important that if you think you're having a stroke, that you get to the hospital ASAP.
Now the F, the A, and the S, do they all have to happen together, or could it be one or?
No, it could be one or.
Okay.
Because some are simple strokes, some are complicated strokes. I mean, some people may just collapse and just, have seizures. So there are various presentations, but those are the obvious ones. Mm-hmm. The ones I wanted to present are the ones that maybe people could think about. So if they think of FAST, I think it's the easiest way for the common person to approach whether or not they're having a stroke or not.
Yeah, I think because just like in my grandmother's case, I mean, she didn't know. I mean, yeah, her chest kind of hurt, but I'm sure everybody at some point thinks, oh, am I having heartburn, or am I just extra stressed out,
right.
And we never want to face the truth of what may be happening, and like you say, the delay could be what.
Is there a difference in the symptoms for women and men?
Yes, that's a very good point. Very good question, actually. In particular, women usually present with atypical signs than men. Men present more with typical chest pressure, tightness, and things. Women could just present with just simply fatigue, a little shortness of breath, maybe a toothache even.
Maybe that's why she didn't know.
Yeah.
Maybe. I'm not.
And indigestion is a very. I could tell a million stories. I unfortunately know a young doctor when I began training, who was an action internist, was having indigestion for 3 weeks, popping antacids. Finally was playing ball with his son when he suddenly dropped dead.
Oh, my gosh.
So, and he was like in his 40s. So.
Wow. Doctor and Kelli, we have a phone call.
Oh, great.
And good morning. You're on the air. Thank you for calling.
Good morning.
Yeah, good morning. Listen, is there certain food to eat and certain food not to eat?
Well, basically, I think healthy foods are the best. Low fat, and especially if you're diabetic, or if your triglycerides are high. I think the biggest problem is with processed food, particularly starches and sugars. If you had to avoid anything, you avoid starches and sugars, because not only can that lead to diabetes, but if you have some even pre-diabetic or what's called metabolic syndrome, you have a slight insulin resistance, those sugars are turned into fats into your blood, which lead to more progressive deposition of plaque. So I think those are basically the foods. Salt, it varies. If you're hypertensive, just watch your salt intake. That's very important, okay? But we've sort of changed our attitude on salt with heart failure. But since it's not a discussion on heart failure, I would advise you come to one of my heart failure lectures, and I'll talk to you more about that. But that's basically it. Just be smart. Eat high fiber. If you're going to eat carbohydrates, eat high fiber for carbohydrates, particularly vegetables and fruits, and you'll be okay.
We do have another phone call.
Oh, great.
Good morning. You're on the air.
Yes, good morning. Thank you for taking my call. If you have no heart problems in your background, your family background, and you're doing pretty good, at what age would you recommend going for a stress test?
Yeah, that's a very interesting question.
When you get married.
Yeah, if you pass the first 10 years of your marriage, you're okay. But I would say probably what I would do is if you have no heart disease at all, and you have no risk factors, and by no risk factors, that means you've been checked up by physicians, and you've had your blood pressure checked periodically, you've had your blood work checked, your sugar checked, and your cholesterol checked. If those are all okay, and your family history, your mother and father lived to age 85, then probably I would say probably not before the age of 70 unless you're symptomatic. Because there's no studies that really show that doing that kind of workup on a patient who has basically no risk factors doing well has borne out to be beneficial at all. So, but I would say probably by the time you reach 70, you get one regular stress test, not a nuclear. And
what about a person that has blood pressure but under control with medication? Should he or she go in earlier?
Again, I would say 65 to 70 if everything else is okay. That's what I would do. If we start stress testing everybody at above the age of 50, we would really increase the cost and the benefits would not be borne out.
Thank you.
Thank you very much. There's so many questions. I know I could probably sit here all day because you know, depending on your age, someone at my age wants to be proactive. You know, we try to get in the gym and do cardiovascular work. We try to eat right and eat well, but there's so many questions. So I do want to encourage everyone to mark their calendar for September 27th, MHC at noon, lunch is provided. Also September 13th, 3 p.m. at Brookdale Paddock Hills. You can go, there is a website that you can visit for more information. That is go to mhc.com. You can also call to RSVP. It is 274-9555. And we'll put all of this on the Ocala Magazine Facebook page as well. So if you were driving and didn't get an opportunity to write all of this down, we'll make sure to include this on the Ocala Magazine Facebook page so that you can be there, because it's such great information. You know, it's a matter of really saving your life just by knowing. Just by knowing. So I want to thank Dr. Savino for being here today. It was so nice to have you. Nice to have a guest. Nice to be back in the studio finally after a few weeks. So everybody, please grab a copy of Ocala Magazine. Like us on Facebook. You can also go to our Facebook page to sign up to receive the digital issue free each month. We're doing a lot of exciting things. And at some point today, the Best of the Best survey will launch. So if you don't like us on Facebook, you might miss it. And we want to make sure everyone has a chance to vote for all their favorites.
Just got a text asking for the doctor's website.
Okay, it is go to mhc.com.
Okay.
So GOTOMHC.com.
All right, excellent.
All right, thank you so much,
Thank
Dr.
you, Kelli.
Savino.
Thank you.
Thank you for coming in. We'll take a break. Be right back.
What makes you look so good? Why don't you love me like I know you could?
The weather is brought to you by myfwc.com. Safe boating is no accident. Sunshine mixing with clouds on this Friday.